Good morning, good afternoon, good evening. Welcome all to today's discussion. And we're talking about what data and evidence do we need for the grant cycle 8. So, all about GC8 today. And we're super excited to have you. I know it's a crucial time that we're having this discussion, but this conversation comes at a very critical moment as we prepare for Global Fund Grant Cycle 8. I mean, a cycle that we know very well will shape the next 3 years of HIV, TB, and malaria. Um, so today is about one thing, making sure that communities, especially civil society and country advocates, have the right information at the right time to influence JC8. So if you have any questions and you feel like, during this discussion something is not clear, please feel free to, use the chat function and we're more than happy to, circle back or just clarify what is not clear. But the Global Fund process moves quickly and the decisions taken over the next several months will directly determine what gets funded, what gets deprioritized, and what services actually reach communities. So that is why we're looking at what is coming in GC8, what information do advocates need at each step, and how can we make sure the community voices shape the final grants. So, ladies and gentlemen, on behalf of Data ATC, ENASO, Compass, AMFAR, KP, TNC, Global Fund for Women, and all the partners who have made this particular discussion possible. Welcome for the next 1.5 hours. We will be talking about what data and evidence you need while we're lobbying for support around GC8. But also want to hear more from you on what is required, what are the gaps that are there, and how can we also address those gaps. So just to highlight that this is going to be recorded, the session is being recorded, and also it's going to run for an hour and a half, but unfortunately, it's purely being run in English. We will communicate in the next few days on when we're going to have the French equivalent of this discussion. But as I mentioned, welcome. This is an open discussion. We want to hear from you, but we also want to share key dates that are crucial to communities and civil society as we lobby for, funding around GC8. So what data and evidence do you need? That is a crucial question that you need to keep on asking yourself all through. Um, for the next bit of this discussion, I'm going to call out Alana. But before I do that, ladies and gentlemen, I think by now I feel like we've already known each other so much as we talk about, data, research, funding, and also community. My name is Livia Tai, and I'm the Development Communication and Partnerships Consultant for ENASO, which is an advocacy organization headquartered in Arusha, Tanzania. Anything community related, anything health related, that's our main business. And for communities, they're at the core of everything that we do. So I will call upon Alana, and she's going to take us through today's presentation. But as I mentioned, ideally, we are going to let you know what needs to be discussed, what are the key dates, etc. But also, we want to hear from you on the previous grant cycle, what you felt like was a gap, but also what data do you need all through this particular process. So, ladies and gentlemen, let me welcome Alana, but feel free to use the chat function, introduce yourself. We want to know who's here because we sent out this to a wide majority of people and different platforms in order for them to join in and also give us their 2 cents on the discussion. So we do have over 70, 80 people now on the call, and we know the numbers are going to continue going up. So we welcome you and we want to know who you are and where you're joining in from, and also look forward to just hearing from you on your experience. So, ladies and gentlemen, let's get started. Alana, over to you.
Thank you. Hi, Lizzie. Hello, everyone. Good afternoon. I do want to acknowledge that we have several of our partners on this call, so we have a good team of people to respond to questions and to have a good discussion. So thanks everyone for being here. Let me just start by sharing one of the, all of us are here as part of the Global Advocacy Data Hub, which is a new resource that we're hoping to release in the coming week more formally. And so it's meant to be a space to have data and technical tools and evidence to help people in their engagement with the Global Fund. And so you can find this resource at the GADH, Global Advocacy Data Hub.org. And so that just to share This is new. We're hoping to find more partners. We're interested in expanding this. And so please let me know if you have more questions about that. So why, as Lizzie shared, I think we'll just share very quickly that why are we here? The first thing is we want to understand what people need, what the highest priorities are for people. And then so that we, as the Global Advocacy Data Hub and all of our partners, can prepare tools and gather data and do analyses to support you. So that's the idea, is to understand what the needs are, and then we can help you be ready for grant cycle 8. So what's coming, and then what do we need? And I don't know, maybe everyone is well aware of this, but let me just go through quickly to talk about where we are today and how we're going to get to the grant cycle 8 Global Fund grants being approved. So as maybe everyone knows, the replenishment is the first step. So that's the time when all the donors pledge how much they're going to contribute for the 3-year grant cycle. And then after that, the Global Fund is going to publish which countries are eligible and then do the calculation for how much each country will be allocated. After that, the Global Fund will send letters to each country with how much they were able to apply for each component, so each disease. And then after that, it's the funding request process where the national consultations take place to plan how to use those funds, which is then approved, reviewed by the technical review panel. And then after that, it will be the grant making process where the final grants are developed between the principal recipient and the Global Fund, which is then approved by the Grant Approvals Committee. So this is the big process that's about to begin. I think many people are very familiar with this. Just as a reminder to everyone, the replenishment is happening on Friday. So that's coming very, very soon. We're going to have an idea about how much funds will be available. After that, we expect that the eligibility and allocation will happen shortly after that. And then the allocation letters are expected, last I've heard, to go out to countries in late February, early March. And then after that, the funding request deadlines, what we've seen is for countries that will be coming to the first window of reviews, it will be due in June, window 2 is July, and then window 3 will be October. So that's a big part of 2026. And then grant making usually will be about finished about 7 months after that. So that's the time point. And in terms of where communities can and should be engaged, I think to me the biggest time points are going to be understanding eligibility and allocation, starting to pay attention to see when the allocation letters are sent to your country. And then the big thing is going to be participating in the consultations around the funding requests. So spring and summer will be a big, big time for the first 3 windows, which is when most countries will be reviewed. So why are we talking about, excuse me, why are we talking about evidence and data? So the most important thing that we can be doing right now and coming up to the funding request is to share what worked and what didn't work in the current cycle, grant cycle 7, to advocate for funding for the most urgent priorities for communities, and then to push out very good implementers, so principal recipients and subrecipients and sub-subrecipients, and to make sure that the targets that are proposed are ambitious, but also, possible and achievable, and to make sure that budgets are high enough to cover the full cost of the activities, and so on. But to be able to have those discussions and to be able to make strong case for these priorities, it's really important to have access to data and to information and to evidence for advocacy. So that's why we're here today. And when I think about the kinds of, we'll talk a lot more about this, but what kind of information I think people will be interested in or need for the work. Obviously, around replenishment, the big thing will be understanding how much is pledged. And then what is that going to mean for the amount available to countries? Is it going to translate into big cuts for countries or not? I think once eligibility comes out, it'll be important for people to understand, of course, what you're eligible for. Again, is the allocation much higher or lower than grant cycle 7? And then to start getting ready by understanding who represents you on the country coordinating mechanism, because that's the people you'll need to be talking to when it comes to funding request development. Um, when the allocation letters come out, I think that that's where you'll start to get some details, and it's good to understand if there's, how much was allocated, but also is there any additional catalytic funding? This is where, there can be information about how much the government has committed to put in as co-financing. Are there any special priorities that have been highlighted in the letter? And then again, when are the national consultations going to start taking place and how can you get involved? And also important data to understand is how can you apply for funding to be able to engage in the process. Um, the funding request stage is the time when there's going to be big need to use data. So first of all, understanding when you're submitting its funding request is key. Um, and then the big work is pulling together data about what the community priorities are, what you want to put into the community annex, and be prepared if there are discussions about cutting budgets, what are the things that can be deprioritized and what is essential. Another really big one that is a big information need is understanding where the biggest gaps are. And that's a question all the time, but in particular right now, because we just did a reprioritization where grant activities were cut. We also know that at the same time, for example, U.S. government PEPFAR and PMI have cut back funding, and so understanding what has been cut, what's still being funded, where the gaps are. In terms of programs, but also in terms of geography, in terms of populations being served, things like that. So that's a big data need. Um, and then understanding what worked well last year, I think is essential. So did we achieve the targets? Did we absorb funding that was meant to be spent? Why or why not? And then understanding which PRs and SRs and SSRs were most effective, I think is key. So those are some of the data points that you may already have, maybe you need. After the TRP reviews the funding request, I think there it's good to understand what the TRP said. Sometimes they ask that things be changed or ask for revisions. And then a big one is understanding what is going to be changed between the funding request and when the grant is approved. During grant making, understanding how to participate, asking about which activities are going to be changed. And then this is also a time to be understanding what's happening with the subrecipients and the sub-subrecipients, like who will be implementing the activities, how can I engage in that decision-making process. And then lastly is, did the grants get approved? Have the board approved them? Did the PR sign the grant? When will the grant activities begin? And how can I participate in grant oversight? How can I use Global Fund data, CLM data to oversee grant implementation? So there's a lot of points for engagement. There's a lot of needs for data. And so, these are the things we talked about. Potentially data that you may need, maybe you already have, maybe you don't know how to find. Um, and so, replenishment amounts, allocation, eligibility, how to get in touch with your CCM member, how to apply for funding to participate, how to request technical assistance, maybe, when the TRP review windows are and the deadlines, what are the top priorities for communities. Understanding what the CLM data show can also be useful. Understanding what activities have been cut during reprioritization. And then what activities funded by U.S. government have gone away or have changed? And then what was the performance of grants last time? Which PRs had the best performance? Where was the highest and lowest absorption of funding? And then how have budgets changed? What was the outcome of the TRP and GAC review and approvals? Um, and who's being selected as the subrecipients. So those are some of the data points that I'm thinking about. And just to say that some of this we're already working on developing. So as we said, there's this data hub, which is meant to be a space to have access to. We have some dashboards, we've got some reports. We're hoping to bring everyone's reports into one place so it can be a one-stop shop for you to find things you need for your work. Specifically on CCM engagement, we have a lot of information about eligibility, funding request timelines, what's in the grants, things like this. So we have some things, but what we're hoping to do is figure out how to make this better and to design resources and things that you need the most. And then I know that Learning Hubs just had a webinar to hear more about the Global Fund's data system. So the Global Fund has its own place that you can go to find information. So that's kind of where we are right now. Um, so I think let me stop there, and I wanted to pass back to Muko maybe to share a few remarks, and then I think we were going to go to discussion, hear more from everyone. Um, so over to you, Muko, if you're on the call.
Thank you so much, Alana. Um, it's just general points on what Alana has shared. You know, there is that particular part about data, but there are also um, those particular points that focus on full engagement. And then, of course, ensuring also there is strategic alignment. So one is there is need for us to elevate, to think in terms of elevating community voice. These are completely, the global health architecture has changed. And of course, you can be able to see also with what is happening in the countries with the new PEPFAR G2G MOUs. So there is need for us to start preparing early. So meaningful engagement. So ensuring that, of course, all the constituencies that need to be involved, they should be key populations, PLHIV, young people, women, etc. And then also the issue of the prioritization of needs. So we need to really start seeing exactly how to ensure that interventions that, of course, address the structural issues and human rights barriers are also, we need to start thinking about that. And then there is the issue about the community system strengthening, we need also to think in terms of advocating for robust investments in community system strengthening and community-led responses. You see, and then of course there is the issue about, of course, maximizing the CCM influence. So we ensure that, of course, the CSOs should basically be active and very well informed, and all the constituencies should also be represented within the CCM. And then, of course, the issue about the monitoring, that will basically come later. But now, in terms of also strategic alignment and sustainability, there'll be the issue of domestic financing. Of course, this as we basically go to this particular to GC8. Of course, we know exactly from January this year a lot has changed, and also you could be able to see also during the reprioritization process. And now, and of course, that is some of those are the issues that we basically will discuss together. And then also to see whether some of the issues that we are discussing about that we would like exactly to be captured in the Global Fund, in the GC8 proposals are also in the national strategic plans. So, because I know at the moment, several countries are completing their national strategic plans. And maybe there's a window of opportunity. Some of the countries might be launching them during the World AIDS Day. Maybe some of them will launch them later. But of course, if there is still a window of opportunity and you feel that you can be able to really input into those particular plans, kindly do so. So, and then apart from that, of course, something very positive. This particular morning, we have had a pledge, the replenishment pledge from Uganda to the Global Fund of 3 million. And of course, this is basically 50% above its normal contribution, because up to now, Uganda in total has contributed about 6.8 or 6.9 million to the Global Fund. So we need also to continue pushing our countries to be able to pledge and, of course, prepare very well for the replenishment conference that is basically coming up on the 21st of this particular month. So thank you very much. I think I hand it over to Liz. Bye. Thank you.
Great. Thank you very much, Moko, and thank you so much, Alana. So what I've noticed is we do have a lot of countries who have logged in, and we already have clocked more than 100 people on this particular call. So then that means this is a crucial information and a very much needed discussion around GC8 and especially what sort of assistance is needed for civil society and community groups. We are going to open it up because we have a few questions, but we really want to hear from you on what's going on and what you feel like would be needed. So this particular bit is going to be more of what do you need? And that's how we started the discussion. What do you feel like you need as communities in aiding you with your advocacy efforts? So, what data, evidence, or information do you need? Um, and what did you need in GC7? What were the gaps or what really worked? What did you use? Because we're also trying to open it up and make it more of a learning session. So if something you use that helped and worked out is something that could be replicated by somebody from this particular call. And I've also seen we have a lot of African countries. It's quite a huge representation. We literally have so many countries that have logged on to this particular call. Yeah, so let's open it up. We still have people that are still joining, so we'll be admitting them in the back end. Let's have the hands up. But if you have a comment, you use the chat function. We will be keeping a keen eye on that as we have the team. So Alana, how do you want us to do? Let's take one round of questions before we dive in. But also I've seen a lot of requests on the PowerPoint presentation, Alana, that would like us to share that after this particular call. So Alana, that will be the first question I'd want you to tackle before we start taking in questions. I've seen a couple of hands up already.
Yes, we will definitely share the slides and then a recording of the call, so that's fine. And we can take a round of questions. I just also want to share in addition to what data and evidence do people need, that can include, research, it can include data collection, it can include anything that we can think of. And I think also important to think about what kind of support do we all need. So in the last cycle, would it have been helpful to have one-on-one peer support? Would it have been helpful to have more webinars or like a WhatsApp group where you can ask for data or, anything that we can think about that will make it easier, I think is a good part for the discussion also. So so back over to you, Lizzie. We can get started.
Thank you very much for that. So repent, you can just unmute yourself and ask your question, and then we'll go to Leslie after that. So repent, over to you.
Thank you very much. My name is Repent. I work for Active Youth Agents from South Sudan. My request is more of yes. The other issue that we wanted to say is how can we have access to technical assistance in order for us to prepare our community for community strengthening and then also community engagement, because normally we get a challenge on how to engage community effectively so that we can able to push our government to pledge or to contribute to global fund, and then at the same time to implement global fund according to the standard. So this is my issue. If there is opportunity, kindly let us know so that we can also respond. Thank you.
Lovely, thank you very much. And yes, technical assistance, TA for communities is something that has actually kind of been very beneficial, especially with the funding landscape that we're facing right now. So we'll also touch on that. Leslie, over to you.
Hi everyone. Thank you so much to Alana and to all the partners. I think mine is a suggestion around, in terms of like from learnings in the past, what kind of information could be useful at a country level, but also I'm wondering if data, etc., and the partners will be able to maybe work on this since you have this convening power around data. But for me, whenever I work in a country, when it comes to, did I introduce myself? It's Leslie Wendell. I'm a consultant that supports around lots of different things around community engagement. But what I found in the previous cycle was whichever country I worked in, there was usually the writing team would have like a folder. And in that folder would be almost every single document for that country that you could possibly think of. So it would be like the previous national strategic plans or the current ones, shall I say, across the three diseases, any other strategic plans that might be relevant. It would have all the gender and human rights assessments that have ever been done in the country, including maybe some CLM reports, like key reports. It would have all the like key epidemiological data from like the country. And I know some of this you get because you're connected to the country. Um, but I think a lot of us, some of us actually might still have those documents from Grant Cycle 7. And it might just be a case of like updating what we have. And I wonder if this, this data hub is able to like hold that, and we could even have like a template list of all those documents that we can think of and try find them for as many of the countries as we can. So that's just my suggestion and learning.
Great. Thank you, Leslie. Ladies and gentlemen, we've gotten to the part where we're opening up for discussion so that we get to understand what sort of information do you need, but we're also using it as a learning session. So we want to know during GC7 what worked for you or what challenges did you face. So please feel free to use the chat option, also raise your hand. So I know we talked more about, and I'm taking this back to Muko and the learner. And of course, under the learning hubs that are supported by the Global Fund, technical assistance is usually provided. And if the learning hubs are also on the call, please feel free to leave your contact details on the chat so that the team here can actually reach out to you directly. But Alana, our first question was on TA and how can they get support on that? And of course, Leslie brought out data aspect, which is very crucial, especially what kind of data is needed on a national level. Is there like a deck of templates on information that is available that can be used? So I will let Alana pick those two questions up. And I'll have a quick look and scan the chat. So Alana Muko, over to you.
Sure, I can get started. And Lizzie, hopefully you can add also because the learning hubs have a huge amount of
Yes.
information on this. I think in my understanding is that usually the TA can come through the global. There will be some support from Global Fund for technical assistance. The big question is how much will be available. It will depend on the replenishment. But in the past, for example, the community engagement funding stream was used for technical assistance and so on. There will also, in the past, there's also been technical assistance through, like Expertise France, through UNAIDS, DSM, and so on. But this is going to be much less than in the past. And so that's part of one of the reasons why we're here is to offer additional support because we know that it will be challenging. And then the other thing is that there will be funding through the CCM itself to help with consultation costs to participate in dialogues and things. So an important part is understanding how to reach out to the CCM. So from my perspective, I think one thing that we can do as this team is to bring together all those resources, all the information about how to request technical assistance and funding, and we can share that back with everyone as one of our resources. So I think that's a great idea. To Leslie's point, I think that's a very, I think it's a brilliant idea. We could absolutely um, pull together, a space where if you're in one country, you have all the documents you need. We can have it nicely organized and indeed we could send out a request, if you want to add things, if you have past documents, let's put it all in one place so it's a resource for everyone. So I'm noting that down. I think that's a great idea. And maybe let me pass back to Lizzie if you want to share more about TA.
Yeah, great. Yes, of course, we do have the Global Fund regional learning hubs, and ideally, one of the areas of support from the learning hubs is providing technical assistance. Now, the beauty is you don't have to stress much because the learning hubs have been divided region based. So we have the ones that are handling the Anglophone, Lusophone, Francophone, the MENA region, etc., you name it. That's because we've taken also the government has taken into account the language aspect. So when you're reaching out to the learning hub, there's specific contacts that are there, which I'm going to share the link on the chat. So, of course, one of the key roles, apart from providing technical assistance, is also just sharing updates on what's going on with, the Global Fund. So issues like the grant cycles, etc., but also using those platforms on sharing relevant, information, but also having open discussions around TA. So, for example, I'll share contacts for the Anglophone and Lusophone Learning Hub, which ENASO is handling. And we have had different discussions, not only via newsletters, but also having one-on-one technical assistance or webinars telling you what is available, how do you go about it, etc., and who you can reach out to in case of any issues. So those kind of measures have been put in place, and I will share more information on that. So in that particular aspect where you're asking about technical assistance and how you can get more information around that, I will send that particular link and please feel free to reach out to them. But also, if the learning hubs are on this call, I know I saw a couple of them on this call, please also just use the chat, mention which learning hub you're heading, and leave your contact discussions there. Um, um, Yes, there's somebody who's used my link, I think, called Liziotai. Could you please rename yourself? I'm getting a little bit confused. Thank you. But Alana, let's do another round of comments or questions as we carry on with the discussion. And ladies and gentlemen, as I mentioned earlier on, we are trying to see also what has worked, what has not worked, but what would you think needs to be improved on? And in terms of needs, because we do have a lot of community groups. I've seen also people in research also mentioning that they're on this particular call, and I've also seen some CCM members. So it would be good to see what is the need that you would require in terms of data or support to help you with your GC8 advocacy efforts. So we'll open it up.
Please.
Oh, Richard, yeah, over to you before we take Vernon's question.
So,
over to you.
yeah, there is some of the questions that Leslie asked. And this is about how do we get data way in advance. Of course, the practice, especially during the grant writing, has always been to bring all the stakeholders together in one room and to have them, and that is basically, that is usually the time when the government coffers of data are opened, because you have also all the stakeholders in the room. You have WHO in the room, you have UNAIDS, you have PEPFAR in the room, and you also have the government in the room, and with all the different areas, in the different ministries. So in most of the cases, that is when you are able to really get very, very important and, of course, very updated data. But the normal case has also been the community convenings before the grant writing process, and the earlier this is done, the better. Where you can basically start maybe having different communities meeting and to try and put their priorities together. And this particular time, because this is a very, very unique time, it's really important for us not to wait until when the allocations start, maybe in February, or maybe when we are basically coming up with the funding requests, depending on the window our country will go with. It's really important that different constituencies, community constituencies, start meeting now, and of course start prioritizing to try and see exactly what they can be able to do. Luckily enough, also, IAS came up with what is called a TIRE framework, which can help quite a lot the communities to prioritize. And the Compass Coalition worked with that particular TIRE framework, and of course has been able to, it has also been able to customize it to community needs. So what would happen is the fact that all this basically will be able to also, because our main aim is just to be able to put a particular resource, this is in the guard, so that you can be able to get all this particular information, all those particular information that you really require, especially. And of course, but in terms of how you prepare as the community, because as the community, of course, we sure that, of course, you have done quite a lot in terms of CLM. But now the most important thing is for us to consolidate all those particular findings and to try as much as possible to ensure that we as a community are able to go to the government with one list of priorities, so that at least we can be able to speak to them and we can be able to push them into the proposals that we are writing. Thank you.
Thank you very much, Muko. And also to reiterate, because I've seen some hands up. So in terms of technical assistance, the learning hubs also are in communication with other TA providers, not only Global Fund. So when you reach out to them, they will give you more details around chat, and also the PDF version that has all the contact details. So please save those and do reach out to regional specific Global Fund Learning Hub contact person for assistance. Now, I have a question, suggestion from Phillips, and Phillips is saying, what gaps, suggestions of what gaps in essential services, interventions exist and need urgent filling or repair? What additional gaps and shortfalls are expected? Link them as clearly as possible with cuts in US funded programs and reductions, cuts in GF allocations. Now, communities can bring key information on gaps and shortfalls from patient and health service levels. And this really works quite well. Thanks, Philip, for that, because we do know how crucial data is, but it has to be evidence-based. Yeah, there has to be a lot of backing when we're saying this has happened and there's a shortfall in this particular area around HIV, um, access to ARVs, etc. So you have to back it up. So thank you, Felix, for that. I'll call Vernon first, then we'll go to Women for Global Fund, then Omar for the second round of questions. So Vernon, over to you. Vernon Open Show. So I don't know whether that's an organization, but feel free to unmute yourself. Okay. Let's go to Women for Global Fund. You can unmute yourself and ask the question. We'll circle back to Vernon.
Thank you, Lizzie. I'm Angela, the Global Coordinator at Women for Global Fund. Thanks also to Alana and the other partners that have shared these important concerns and challenges. From our side, I think it's very important to also share that as we are navigating also this part of the inclusion of new things, probably that might be the hardest thing. So the advice probably will be to be very mindful about what was deleted or what was reprogrammed or what was probably not prioritized on the Grand Cycle 7 to be reconsidered to Grand Cycle 8, and also aligning those efforts as a community and society representatives might be easier to push together than working on, different priorities or new things to be included. And also, as I think the other colleagues mentioned, it's important to have the data and the information from CLM, gender assessment, stigma indexes that can be useful to sustain the advocacy efforts to why we need to keep on including that. And specifically, I think it's also very valid to ask before, if you were not engaged in the reprioritization process, you can ask also CCM representatives to show what happened at that time, what things were deleted, and how can you also support other advocates to include and re-include some of the actions that were deprioritized. Also very important to be familiar with the modular framework and the new documents that are going to be available in the next few weeks, to just check. But also remember that the modular framework will not be an extensive list of priorities. So it's important to kind of analyze where can you fit those things, and check not only on HIV or tuberculosis alone, but rather on the integration of the disease components. From our side, finally, also to indicate that we are here also to support the countries and also the advocates in terms of how to include more than the specific priorities and the human rights components. So please feel free to reach out and also check our website, in which we have included many of the resources and advocacy messages that you can use already on the CCM dialogues. So give an over.
Thank you so much, and thank you for highlighting that, because Women for Global Fund is also a partner that has made this particular call possible, and we appreciate that. And also do reach out to them. Please leave your contact details on the chat. And I know when you're talking about CCMs, I would like to also ask, do you know who your CCM is? Are you in contact with them? If not, while you're reaching out to the Global Fund Learning Hubs, they can also connect you directly to your national CCM representative. Omar, I've seen your hand. I'm not sure whether Vanon is back, but let's go to Omar first. Omar, over to you.
Hello, Lizzie. How are you? Hello.
We can hear
Hello,
you.
Liz.
Please proceed.
Okay,
I
good.
can hear you. Please proceed. Yes.
Perfect. Okay. Lizzie, I just want to go through something right now. The presentation is great, and there's a great deal of information in it. But the core challenges of the communities or civil society organizations at country levels, I think from my own understanding, those are the major problem or issues facing the communities. We might be able to have the data, we might be able to have the information and the know-how to be part of the whole process, but at the end of the day, when you've been part of the process doesn't make any difference or doesn't change anything or doesn't even matter, is a call for an alarm. If you look at it, with the Global Fund replenishment, it has been sold by the communities and the civil society organizations. We've been on it for the past 2, 3, or 4 months, calling for replenishment for the Global Fund from countries to organizations. We've been doing a lot as a community through GFAN and Women for Global Fund and ACT, TB Coalition and other organizations that have been involved. We've been calling on replenishment and for the Global Fund. But at the end of the day, all those efforts the communities are putting in place, at the end of the day, when it comes to the actual funding at the country level, communities are always put aside. Our inputs are just put aside. Our initiatives or interventions are always thrown away, just like what happens to us in my country. As an example, in the Gambia, it happens to us last funding cycle on GC7. All what we requested based on the modular framework, using the modular framework as a guide, all the priorities on community interventions and capacity strengthening and other issues that we push forward at the end have all been thrown away by the CCM Secretariat, and for nobody understand what the reason was. And basically what I'm saying is that with all these efforts we are doing, everything that we are doing, if there is no form of mechanism to make sure that communities' voices are included, their initiatives are prioritized at country level, then it is all useless, because we've been on this for years now, Lizzie. We've been learning, we've been pushing forward on initiatives and other things, but it's not only Gambia, it's across the board. At country level, communities are always treated, I would say, unfairly and pushed aside in when it comes to funding and the grant or the GC7 or whatever grant it is. So just my question is, what are we going to do to make sure that communities' interventions and communities' voices are being fully incorporated in the country level and the Global Fund, from the funding request all the way down to grant implementation? Because the tradition is that we are always invited in the funding request, but when it comes to grant making and grant implementations and other things, we are always pushed aside, because they obviously need us to be part of the funding request, because we, at the end of the day, the community representatives at the CCM will have to sign and endorse the funding request. But apart from that, from that moment on, communities are pushed aside, and our priorities are decided by them. They will decide what should be given to the communities and what should not be given to the communities. It is just crazy. And sometimes some things that we hold very high might just be thrown away because they don't understand that this is a very important priorities for us. For example, I will give an example of community-led monitoring program. In the Gambia, during GC7, we requested for a community-led monitoring to start a book of community-led monitoring. At the end of the day, you know what happened? They give the community-led monitoring package to a government institution, the primary healthcare. And at the end, the money was wasted. There was no good results out of it. And we then approached the country team to look into that matter and have a concrete discussion with them regard to community-led monitoring. And finally, now the country team agrees with us because the CRD agent among the country team was in full support of what we are saying, and with what the strategic document that we put forward and the budget that we put forward was completely in line with community-led monitoring, as it is happening in other countries. But this is what helped us even to gain back that community-led monitoring initiative. If not for us and the country, the CCM Secretariat and the PRs, we will never be able to get anything out of it. So this is a very big challenge for communities and civil society organizations at country level. We are always invited, but at the end of the day, they decide. So this is what I'm asking. What mechanism are we going to put in place to stop things like this from happening to the communities? Thanks.
Thank you, Omar, for bringing that in. That is quite disappointing because ideally meaningful inclusion means that whatever civil societies and communities also voice out should be included in the last document, not just to have us at the table in order to check off a box. I have had your concern, and I'm hoping that some of the partners on this call might have an answer to that, or maybe have a country that kind of tackled similar issues and came out, having a seat at the table, having meaningful inclusion, and having their voices heard. So it will be good to hear from you, but we really do hear your concern, Omar, and we've had a couple of concerns about that. Now, the beauty is, I'm not advocating, but ideally, this kind of concerns also, we have channels to kind of raise such concerns through the learning hubs. And please, as I'm reiterating, because this is very crucial, we really need to have evidence of this kind of happening. So do also reach out to the learning hub. But of course, I'll have my partners, Muko and Alana, talk about that. And also, Muko, do touch on the discussions we're going to have about funding tomorrow, and trying not to have the voices of communities being liquidated. Vanan, you're here, so what we'll do, we'll take your question, and I've seen Watara's and Rupen's hands up, which will be the third bit of the discussion. So let's go to Vanan and then circle back to Muko and also Alana on some inputs. Over to you, Vanan.
Yes, thank you, and my apologies. I am having difficulty hearing, and so I didn't realize I was requested to unmute. I'm wanting to talk from the perspective of a sub recipient, an SSR. We were brought into GC7 in December of the second year, and so we came in very late, and Afrique Rehabilitation Research Consultants works with people with disability. And that is the first observation, is that people with disability, it was almost as if we were an afterthought. I know at the same time women and youth were also brought in at that stage. So the importance of including people with disability, I think, cannot be overemphasized. And then it is a plea as we go into to GC8. Professor Jill Hannes Hancock of the SA Medical Research Council represented people with disability on the proposal writing team. And yeah, we have a report of that. So I'm not certain how that feeds into this particular process of GC8, because I think to some extent in South Africa, there already some activities or programs are running. Now, my concern is not so much about what is needed prior to us entering into the program, and that is purely and simply because the people that we have representing and working on the ground, gathering the evidence, the data, are people who are rooted in the community. So, you know, they know their communities, and I'm looking at this, it's community led. So we look at the community to begin with to give us the way forward and the challenges that are needing to be addressed. So, but it is what happens afterwards, and I don't want to have a go at our SSR, but at our SR. They had a situation room set up, and in February 2025, like 2024, I went to a presentation where the people who were involved in setting up the situation room produced marvelous graphs and what we were going to be able to present in terms of evidence. And we were working in 3 provinces within South Africa. And at the end of the day, when I said to our SR, please bring together the challenges, the data that was gathered over those just over a year, 15 months or so, so that we can take it into the provinces, take it into the districts, and share it with them. And there was nothing. There was nothing. There was also apparently a report. Sorry, I'm being negative, but I think we need to learn the lessons of this, because it has made us look absolutely foolish, because we were not able to go back to the provincial health departments and say these are the challenges that people with disabilities are facing in your clinics, in your health centers. There was a report produced by an independent consultant for year 2. We've never seen that. I don't know if anyone else has seen it in South Africa, but I've never seen it. It was then decided that the sectoral representatives would get together, and we did so in the West Rand of Johannesburg for 3 days or 4 days, obviously some great expense. And we were part of writing a report that we've never seen. And one has to ask the question, what was the purpose of that particular CLM intervention in South Africa? So I think, you know, that is, we are happy to do the work, but it is what comes afterwards and what we feed back into the community. I mean, one of the instances that cropped up again and again was adjustable examination beds. Now, for a person, particularly wheelchair user, but even a person who is visually impaired, to negotiating getting onto a high examination table becomes a major challenge. And yet that, you know, that is kind of lost. But another aspect of this is the National Department of Health. To what extent do we feed into them? At a provincial level, we struggled to get memoranda of understanding, and it was ridiculous
Maybe
that.
to give you, Banan, maybe you can try and wrap up. Sorry, I've just seen a couple of hands
Sorry.
coming up.
No, fine. I can put stuff in writing if you'd be happy with that. But it is, you know, there's no point in reinventing the wheel. We've been here, we've done this, and we really want to see it happen. for the community that we represent. Thank you.
Thank you very much, Vernon. And also, ladies and gentlemen, that's why we're also trying to see. We do have a lot of concern. It looks like the case that was presented from the Gambia is the same sentiments in South Sudan, and somebody has said that is also the same case in Kenya. But there must have been something that worked, and I like what Vernon has said. Let's not reinvent the wheel. There's something that also have worked that we would also like to hear from the team. But let's go to Watara, and then we go to Adia, then repent, to kind of see whether there's any feedback from your end, and what's kind of data do we need, what information do we need as we focus and gear up for GC8. So Watara, over to you. Please, let's be mindful of time because I've seen a couple of hands come up. Watara.
Thank you, Lizzie, Alana, Richard, and team. This is very insightful. I'll just take it quickly from GC7, and I would first of all agree with what Omar has said. Our problem with regards to Global Fund is very similar, and it cut across, our challenges cut across regardless of which country you find yourself in Africa. And I totally agree with you when it comes to grant negotiation, involvement of community, and making sure that community sit at the table, negotiate, and ensure that resources are allocated where it best fits and maximize impact has always been the challenge. Total engagement or meaningful engagement has just been calling community members to sit around the table and tick boxes where it fits. But when it comes to resources where critical impact or resources are needed to address community challenges, that becomes the problem. But I'm looking beyond that and seeing how best we can use the CCM platform that we have in Africa. I know, Iana, so Liz, you know of that platform. How do we use that platform to sensitize and ensure that community members or CCM members that are representing community on CCM are able to advocate or come together to ensure that grant negotiation, community members or community are being put on the table? What mechanism, what roadmap are we going to put up to ensure that lessons that we've learned from GC6, GC7 shouldn't repeat in GC8? How are we going to ensure that we are meaningfully engaged? We have that platform. It's left for us to make good use of that platform. I represent Keep Up in Ghana, and I'm looking at how we are going to use the KP consortiums. And I'm very, very happy that Richard is on this call. We have the KPTNC. How are we going to ensure that this platform that we have is a platform that we are going to use to intervene in these critical places, because these are critical points for us. Once GC8 is passed, we are going to wait for another 3 years, just like GC7. But how do we ensure that we get it from the word right go, so that we will not be convening here each and every time that we are at a grand cycle, we come back and voice the same problem over and over again? We have critical platforms like the Anglophone Learning Hub. We have all these platforms. How are we going to ensure that this platform, we put it in a way that in these critical times, this platform are able to help us to ensure that our voices are heard? It ensures that grants are allocated to places that best fit and maximize impact for the community. Mind you, we are in times where we are fall short of funding, there's cut, there's everything. It is best for us to come up with a roadmap. How do we ensure that the available and little resources are best used to maximize community impact? My question is, how do we ensure this platform, KPTNC for Key Population Platform, Anglophone Learning Hub, and other platforms deliberately support community to ensure that our voices are heard and resources are allocated the way that community want to maximize impact? Thank you, and over.
It's a very good question. And I like your comments, Watara. We do not need to wait until after 3 years, then we come back and say, hey, what during GC8? But using, and I like what Tara's brought. I mean, I always love that youthful energy. How do you maximize what is already there? And the learning hubs are more than happy to get into even a one-on-one call with you just to discuss key next steps. What the learning hub is supposed to do is also, just share information and clarify such kind of questions where you feel like it's relating to the global fund, but there are some gray areas you don't understand. So that's why I will keep on insisting on resharing the context for the learning hubs also, but also given the fact that we're facing dwindling funding, we all know that. And we also have the MOUs that are being signed off. I don't know whether Muko you're still here, and those MOUs are also touching directly on TB, HIV, and malaria. So it's not only the funding for GC8, but we're also trying to say if there's any sort of national programs that are intervening in the three diseases, how do we ensure that the voices of the communities are there? That was the second batch of questions before I call Adia, Repent, and Omar again. Maybe Alana Muko, I can bring you on for a few minutes, and then we take the third round of questions.
Thank you very much for the.
Go ahead, Moko.
Yes, thank you. Thank you very much for the comments and the questions. And these are very critical from the Bannon, Ouattara, and the previous speakers. Now, I will begin with the questions that were basically put in, especially the prioritizations of the community not being taken on board. What happens is the Global Fund came up, and of course, Alana will speak more to this, and also Liz came up with a way in which to ensure that community priorities are taken on board. And this was the community's priority charter. And what happens is that during that, the charter basically lists exactly some of those particular minimal priorities that communities feel that should not be done away with. And what happens is that it is annexed. It's annexed to the grant to the proposal that basically goes to Geneva. And what happens is the fact that if at all, let's say, Geneva basically receives also that, it is basically able to compare in case maybe, because in most of the cases, sometimes the proposals are, once the whole consultation process is over, then what happens is that it is the programs of the government that basically go to sit and complete, and of course maybe ensure that it is taken there. And of course, in most of the cases, when it's taken to the CCMs, of course, in some of the governments, it's like, of course, CCM members are afraid to be victimized. So in most of the cases, it's basically like, oh yeah, let's basically have this go. However, what happens is the fact that the communities are able, if at all, let's say you feel that your concerns have not been taken on board, then what happens is that you are basically free not to sign, the grant. And of course, you also have other mechanisms, like, of course, appealing over to Geneva straight. And then secondly, in terms of inclusion, and this is a very, very important question that, of course, you raised, Vernon, and of course, Ouattara. Yeah, I would give an example of what is basically happening at the moment, what happened in Kenya in I think, in October. So Kenya, they were able to receive a small grant to enable especially the inclusion of the key and vulnerable populations. And of course, this included the elderly, the people living with disabilities, and of course other KVPs, people in transit, and also others like and also the key populations. Because what they did was they basically got this and they tried as much as possible to see, because they had heard that the next version of the Kenya AIDS strategic framework, which is basically under now the NSDCC, that is the National Syndemic and Disease Control Council, is already in progress. And of course, it was basically like several, it was only remaining with 1 week to be launched. But of course, having gotten this, they were able also to present their findings to the NSDCC. And of course, the NSDCC was able to take their recommendations. into this particular plan. Now, why this is important? It's important to ensure that, of course, the vulnerable populations are able, yes. Hello, Charity, kindly mute. So it's really important to ensure that, of course, you start this particular process early enough because you start, first of all, getting your needs into the country's strategic documents. And then, of course, from there, it becomes also much more easier to push these particular priorities into the grant proposal that you're basically writing. So again, we have started early enough. I mean, we have also started discussing this much more earlier in any case. So what would happen is the fact that it's really important to ensure that, of course, you get the needs of the key and vulnerable population into the country's strategic plans, the HIV strategic plans, and of course the TB strategic plans, and then this you can be able to defend them. And of course, during the grant writing proposal, important to really ensure that if at all, let's say, your issues are not included, bring them in the annex, and of course, bring your complaints in the annex. And lastly, of course, I was in the other webinar that was for malaria. It was quite interesting indeed, because what happens is that we are looking at it in terms of also what are those particular concerns that are, of course, required also in the other disease areas. And it was quite important indeed. And of course, maybe it will be important for the Learning Hub, Liz, maybe to see exactly how we can be able to bring all the partners together so that we can always have one place where we can basically be able to share and to discuss things. And then lastly, there is the webinar tomorrow, and this particular webinar is it's a follow-up on what happened last week with respect to what is going on the G2G, the USG G2G MOUs that are happening in the countries. And of course, as you can be able to see, that is it's basically shifting things quite a lot, but it does not have any effect on the Global Fund. The Global Fund as a mechanism remains the same way. However, I think there is need for us, as we discuss now, to also see exactly what happened during the replenishment process and what happened during the GC7 process, so that as we move forward, we can be able to see exactly how we can position the civil society and the community intervention strategically. Of course, the global health architecture has changed quite a lot. And of course, there could be also slight changes on how we engage also in the GC8 as we move forward. And maybe things might not be business as usual the way they were. And of course, there's need for us to really start thinking proactively, of course, with the end in mind. Thank you. Maybe I invite Alana. Thank you.
Thank you, Mukul. I'll just say quickly, based on some of the comments, I think there are a lot of wonderful ideas and we'll think more about them. Some things I'm thinking about, materials, the updated modular framework and all the new application materials and so on. I think we can, once those are published, we could do additional webinars to help talk through what has changed and what it means for how to apply. So that's one thing we could do. I think the point about the power dynamics and the challenges engaging in CCN is very, very important. And I think we can think about, with learning hubs and all of our partners about how we can build better and stronger escalation pathways so that as soon as possible, if you're not included or you're facing difficulties getting community priorities into funding requests and so on, that you can share it and we can all work together to support and bring those issues to the Secretariat, bring them to the right people in a way that protects people but also addresses the issues. So I think that's important. One thing I'm thinking about is one thing we could also do is to kind of produce a roadmap of the timeline of engagement and then share this with everyone. So it's very clear, like if you're in this country, you're going to this window, here's what stage you should be at. You should already be in discussions, you should already have this kind of information and to kind of help everyone understand, where we should be in the timeline so you don't get left behind. I think another point is that some of these issues, will take much more advocacy to address. And so one thing we can also do is be working together to escalate things to the board, even to try to do advocacy at Secretary to change the way that things are done. And so that's, many of our partners are very interested in this. About things like not being available and published and access to information, I think the comment that Leslie had made about we can have a one place for each country where materials can be published so everyone can have access might go a long way towards addressing transparency and everyone have access to information. And maybe I'll stop there, but there's a lot of great ideas that we can act on as soon as possible. Thanks. Back.
Great. And
Just
great.
to add, can you hear me, Liz?
Yeah. Maybe
Okay.
real quick.
Also, we shall have, just to inform the team, we shall have also a small discussion about this during ICASA. So for some of you who will be there, of course, it will be a small place, I think, provided courtesy of Unitaid, which will help exactly to discuss a bit. And of course, we can also discuss this particular guard facility that is coming up. Thank you.
Great. Thank you very much. We'll go to the next round. So Aditya, sorry if I'm pronouncing your name wrong. Over to you and then Omar. Aditya?
So thank you so much for this opportunity. I just want to say a few things. Like being from India and I am a doctor, I see that there is a very much global funding less in my country because I see that many cancer patients and I want to say this because many cancer patients and even many TB patients, they have these facilities which are very less and they have this accessibility. And in other thing, it is like a bimodal distribution. When you come to the metropolitan cities, like in case of Chennai and Mumbai and Delhi, you see people who are willing to share their money, means willing to give that the funds. So there is a bridge. We should create a bridge where we can have this the funds and it should reach the all the grassroots levels. Like what all things we have discussed, the novel ideas, it should not be just in the meetings. It should reach the grassroots level. So for that, I feel that like how our friends and all has told, we should have this direct funding to the communication levels and there should be four things. There should be the trust, there should be the transparency, and there should be the teamwork, and there should be the togetherness. If we can achieve all these four, and with the taking as a world as a global village, I feel that we can even have this inequality bridges we can reduce. Like I came all with the scholarship. I have studied with the scholarship. I studied with the facilities which are minimal. But I have hit my with the back of the thing. Since I came from the poor background also, I made sure that I came from the scholarship and I want to improve my country more. The all the high-fi things which you are seen, the only are seen in the cities, but rural places of India is still lacking. So from this novel I should say novel experts and from the novel audience, I want to appeal that I want to improve more in it, and I'm ready to get the ideas and I'm ready to get the involved. This is from Dr. Aditya, and thank you for getting me involved in this, and thank you for the opportunity. Thank you.
Thank you, Doc, and thank you very much for joining all the way from India. And we did see you introduce yourself and left your contact details also. But I do agree. We have to see a lot of things in the grassroots level, communities benefiting from all the advocacy work that we're doing. I know this is the third round, so we'll take one more question from Omar and then do one last round for input, and then I'll hand it over back to Alana for conclusion. So Omar, over to you.
Okay, Lizzie. Thank you very much for having me again. I just want to suggest some solutions to this issue. We've been discussing this at our level at Stop TB Partnership as a delegation member at Stop TB Partnership Board. And be the KBP delegation and the communities delegation. Since before the, how to call it again, Malawi, the last Global Fund Board meeting in Malawi. We discuss and collaborate with the Global Fund Communities Delegation in order to take up a vigorous advocacy program that will ensure communities are not only included, but are equal partners of the whole program. Because we started working on it and we already draft a joint statement that's supposed to be signed. I was working on it with Maureen and how to call it again, Mick at the Global Fund Community delegation. We started working on it. My suggestion was that we come with an advocacy program that will target a clear-cut percentage for communities at country level from the Global Fund. If we can post that to the Global Fund Board and it gets approved, that will help us solve all these problems, because most of these issues are all because of the money. You see, the reason why communities have been pushed aside or neglected or doing this and that is all because of the fund. How to share this cake, that's the only problem. So, but if Global Fund can help us save all of us from this trouble by just setting up a small, even it's no matter how small it is, a small percentage for communities or communities interventions at country level. But every country in the global, which is having a Global Fund program. So this will be the one of the key tool that we can use to solve this problem, because I know for sure, as long as the status quo remain, the communities will continue, will be pushed aside as usual. They will be, their interventions will be deprioritized and so on. So the only way to solve this is for us, the communities, to come up together with a very strong advocacy program that will compel the Global Fund to look into this issue and make sure that there is, at least no matter how small it is, there is something for the communities to cover some of the communities' initiatives. Not all of it. I know it will be difficult to cover all the initiatives, but there are some priority initiatives that should be covered under the program. And those are real important, valuable programs that help, for example, in terms of the barriers to services and other stuff like that. Only communities can establish those data and those informations to make sure there are changes done to those areas so the patient can easily access the quality healthcare services at every country in the world. And this has been a challenge in most of our countries, especially in West Africa, has been a challenge, particularly in my country. But this is an approach that I put on the table, and we are still discussing on it, but we need the support of every organization, every community organization, community groups in the world to join together and take it up as an advocacy point in order to compel the Global Fund board to agree on it, and it becomes part of the program. This is just a suggestion I just want to make. Thank you very much.
Thank you very much, Omar. And also maybe to reiterate that such kind of mechanisms have also been put in place. And I think the Global Fund Learning Hubs need to actually, shout more on the amazing work that they're doing. For example, ENASO is a regional organization and its partners, members, are community groups and CSOs across Anglophone and Lusophone, and we have equivalents, as I was reiterating during the call. And these learning hubs are there to help you with your concerns and with your needs. So please do reach out. And as one of the speakers earlier mentioned, that there's no need of reinventing the wheel. Let's use what is there, just make it stronger. If there's any weak mechanism that you've picked out, please also kind of air that out so that they can make improvements on it. But do save that PDF. I'm going to share the link again. Save the contacts of the regional Global Fund Learning Hub in your region, in your country, and please do reach out to them. I feel like most of these concerns and questions can easily be addressed through the Global Fund Learning Hubs. But as we're concluding, we only have 8 minutes. I'm going to take this back to my two colleagues, Alana and Muko, to do more of a closure and insight on what next. We've got a lot of amazing concerns, but also some positive inputs coming in. And we're going to be very ready for GC8 this year, as long as we address most of these concerns and also just improve on the things that are working. And maybe Alana, you can come in first and talk about the Global Advocacy Data Hub, reiterate on that, and also let us know overall what the feeling is like from your end before we hand it over to Muko for some reflections and next steps and close the meeting for today. Over to you, Alana.
Oh, sorry. I don't know if I'm cutting out. Tell me if I am. But yeah, just to share the last thing is what the next steps are from the GAD perspective. I just wanted to share one thing is that on our website we have a calendar of activities. So this is a space where you can check upcoming things related to Global Fund advocacy. So you can see, for example, there were 2 other Global Fund related webinars. There will be the one that Muko has mentioned, focus on PEPFAR. So this is a space where you can find activities and also submit your own event if you're planning something. And then I'll just close here just to say we'll share the slides. There were several requests, so we'll share the slides. We can share a recording of the call and some of the materials like the Learning Hub contacts and so on, and some of our next steps by email. If you'd like to be on our listserv, you can join. You can also reach out to us by email. And once you receive the email with the slides, you're also welcome to continue sharing feedback and ideas with us so that we can start doing the work. So, and I also want to thank all of our partners from the Global Advocacy Data Hub who are here. Thank you, everyone. So let me hand back to Muko.
Thank you. I have just started by sharing the link for tomorrow's webinar, and this is basically a follow-up of what is happening with respect to the USG G2G Global Health MOUs. And of course, there will be quite a lot. And of course, tomorrow we'll basically be able to see what else we can be able to do, because the whole process is ending on 12th of December. So, and of course, there has been quite a lot of concern from the communities. And then secondly, of course, don't miss, we will basically be sending some invitation of GAD at ICASA. So some of you who will be interested, so we'll be inviting you there, so that we can basically be able to meet and discuss formally, and of course meeting with each other, and of course also sharing exactly about this particular new way of engagement, because we could be able to see we need to learn from what happened during the reprioritization process, and to see exactly how we can be able to better, because maybe we do not know exactly what is going to happen. We know exactly Global Fund is not really going to be affected by what is happening in the US, but of course a few things might change here and there. So we need to really think very, very proactively, and of course also think backwards. And then secondly, the replenishment drive for the countries. It's important as we move towards the Replenishment Conference. Please speak to your countries so that they can basically be able to do something better, like what Uganda has done. And of course, we are really thankful to the government of Uganda. They have led the way by pledging more than expectation. And of course, we know exactly most of our countries can be able to do that. So it's really important as we go back, we really request our countries to do so. And then like I go back to Vernon and of course to what Watara mentioned. Yes, it's really important that we start also engaging with our countries to know where the next strategic frameworks for HIV, especially for the next period, what stage they are in, and ensure that, of course, communities are able really to bring their needs and priorities in there. Remember, what is not written does not exist. So it's really, really, really important indeed to do that. And then the other thing is start community consultations as early as now. Let's not basically wait for the funding request to start and then we write. I mean, usually you come to realize, I mean, we have gone to as many places as possible, and you can be able to see during the country dialogues, the government comes and they're very well prepared. But of course, the community comes, and of course, we are all in shambles, because what happens is that our consultations are usually the last minute. But kindly, let's basically ensure that the consultations start as early as now. And of course, we'll basically be having also some follow-up webinars sometimes to just get exactly to see how each and every country is preparing on that. And having said that, I really thank the partners that were involved in this, beginning from Data ETC. To say the truth, this is a very precious partner we have. And then, of course, our learning hub, IANASO. Really, they have always been doing a great job in convening us. And then also Compass, our technical partner, which has always been doing quite a lot of beautiful work, and especially also translating what is basically discussed here in its coalition. And of course, it's like we can always be able to see the other side of the coin. And of course, we are able also to bring back this particular experience to this. And also the KPTNC, that is the Key Population Transnational Collaboration that brings together most of those particular marginalized populations, and of course, populations that are really key in HIV response. And of course, all the PLHIV networks brought under the ambit of IANASO. We really are very, very, very thankful indeed. And also all the CCMs that are basically in the countries. So let's basically hope to meet you again in the future. And this will be communicated to you, but you also don't forget to attend the meeting tomorrow, the community engagement in USG Global Health MOUs. Thank you very much indeed.
Thank you. Bye, everyone.
Thank you. Bye-bye.
Bye-bye. Thank you.
Bye, thanks.
Bye.
Bye bye.